afternoon, everybody. Thank you for joining us here on a beautiful Friday afternoon. We're going to be talking about the vaccine rollout and its progress here in the state. First to join us this afternoon will be Molly Howell, the director of our immunization program.
Thank you, Paul, and good afternoon, everyone. So today I'm here to announce that starting on March 29th, any North Dakotan who wishes to be vaccinated may receive a COVID-19 vaccine as long as they're age eligible. This change is not being made because we're done vaccinating the people who are in phases 1A, 1B, or 1C. People who are essential workers or those with underlying health conditions should still be vaccinated as they are either at high risk for severe COVID-19 or at high risk for getting COVID-19. This change is being made more because most North Dakotans are essential workers or have an underlying health condition, and we're hearing a lot of confusion over who is and isn't an essential worker. Also, people are not self-identifying as having underlying health conditions. And then lastly, we want college and university students who want access to the vaccine to be able to access it before they go home this summer. I do want to mention, though, the Pfizer vaccine is the only vaccine that's able to be administered to people 16 to 17 years of age. And so that vaccine is pretty limited. And so those individuals may not have access to vaccine right now. The COVID-19 vaccine is still very limited in some areas, and so not everyone will be able to be vaccinated right away. So please be patient, but be vigilant if you're interested in being vaccinated. As of yesterday, more than 1 in 4 North Dakotans have received at least 1 dose of COVID-19 vaccine, so 27%, and 16% are fully vaccinated. Our allocations have remained level the past few weeks, but are expected to increase in late March and throughout April. This week and next week, we're expecting 10,530 Pfizer doses, 7,500 Moderna doses, and 900 Janssen doses. On top of the state's allocation, the federal pharmacies, which are Thrifty White and then now also CVS and Medicine Shop, will also be receiving doses. And then 2 federally qualified health centers, Coal Country and Spectra, will also receive doses directly from the federal government. I also wanted to let everyone know that starting April 1st, North Dakota will be moving towards using CDC's Vaccine Finder, and we will start sunsetting our COVID vaccine locator. Our locator has been very useful in helping people find vaccine throughout this pandemic, but our website will still link to CDC's website, which is vaccinefinder.org. This will be more mobile friendly and show people which brands are available at different provider offices. People who don't have access to the internet can continue to receive assistance in finding a COVID vaccine by calling our hotline at 866-207-2880 and just press the number 2. And this is especially important if you're in phase 1A or 1B and having trouble finding the vaccine. We are still getting questions from people wanting to know which vaccine is the best or which vaccine should I accept. And the best vaccine is the first vaccine that you are offered. We're also hearing about some people being North Dakota nice and saying, I'll let other people get the vaccine before me, or other people are more at high risk. And I just want to say that if you're getting a vaccine, you're doing your part to stop the spread of COVID-19 in the community. So I encourage those of you, especially those who are at highest risk for complications, to get a vaccine as soon as it's available to you. Over 100 million doses of COVID vaccine have now been administered in the United States, so I hope people feel more comfortable about the safety of COVID vaccine and accepting a vaccine. And getting vaccinated now will allow us to be able to do things that we want to get back to doing more safely. People want to travel again, see grandchildren, see UND win a hockey game in a full arena, and so please go ahead and get vaccinated in order to get us to those things in a safe way. And then I'm happy to introduce Dr. Jeffrey Hostetter today. Dr. Hostetter is the program director of the UND Center for Family Medicine in Bismarck and the UND Hettinger Rural Training Track residency and has been so since 2005. He is an assistant professor for the UND School of Medicine and Health Sciences, a graduate of the University of Washington School of Medicine in Seattle, and he has completed his training at the UND Center for Family Medicine in 2003 and subsequently worked for Indian Health Services in Fort Yates. Today, Dr. Hostetter is going to talk about COVID vaccine and variant viruses. So I'll turn it over to Dr. Hostetter. Thank you.
Thank you, Molly. I want to thank you all today for the opportunity to talk about the vaccine from a provider's perspective, someone in the community, seeing people and answering questions, and just kind of bring my voice to the call to get vaccinated. The basic question is, why should you get vaccinated? And the reason is basically to protect yourself and to protect the people you care about. The death rate in North Dakota nursing homes has been staggering. When I go to nursing homes and do my rounds, there's so many fewer people there than there were before. It's really disturbing, quite frankly. And the number of people that have persistent problems and symptoms after COVID is also disturbingly high. Right now, luckily, knock on wood, I haven't had anybody with COVID for the first time, actually Monday, for the first time since May, I haven't had someone with COVID in my hospital service. And then I got an asymptomatic patient, of course, Tuesday, so I jinxed myself, but still he's fine and it's not a problem. But I've had more people come into the hospital with symptoms of persistent problems that we can't find any reason for except for coronavirus, and it's a lot of people. And the vaccine prevents the death, and it prevents the becoming a long hauler, as they say. The other question I get all the time is that who's at highest risk, and if I'm not at risk, should I get the vaccine? I mean, obviously, older people with chronic health or people with chronic health conditions are at the highest risk. There's no a debate about that, but there was an analysis that was just published in JAMA a couple of days ago that said, or in the JAMA newsletter, it said 75% of people in the whole country have at least one risk factor. So there's no really reason to limit the vaccine, which is one of the reasons that we're announcing today that everybody can get the vaccine. Everybody should get vaccinated. If you can get the vaccine, do it. You're going to have a sore arm for a couple of days, but you're going to avoid seeing me every day in the hospital, and you avoid seeing me see one of your family members. And even if you've had COVID, this is important, even if you've had COVID, you should still get the vaccine. Especially if you're one of the long haulers, one of the people that have persistent symptoms. Many people, it turns out, are getting relief from their symptoms just from getting the vaccine. We have no idea why that is yet. There's no research that I've seen that there's a lot of people doing hand waving, but nobody knows for sure. But it definitely is real. And so if you're a long hauler, you should get the vaccine. Don't give up hope. The other thing about the vaccine and the variants is that the vaccine, for the most part, the short answer here, and there's lots of technical stuff that Kirby is going to talk to you about in a few minutes, but for the most part, a vaccine is protective against variants. And even if it's not protective in a test tube, it's probably protective in real life. There's a published study from South Africa that the Johnson & Johnson vaccine was 100% efficacious for preventing hospitalization and death. And 95% of those cases were caused by the South African variant. So, nobody knows for sure. I can't tell you for sure you're not going to get sick from a variant, but I can tell you there's a lot better chance you're going to be covered and not get sick, even from a variant, if you get the vaccine. I have been vaccinated. I was one of the first people to get COVID, actually, in the state. I still got vaccinated. My family's vaccinated. I recommend to all my patients that they get vaccinated. It's just the safe thing to do. Last year was the first year since we've been keeping track that there was an actual reduction in life expectancy in this country, and this is due to COVID. And if you hear people tell you otherwise, they're just wrong. You can't argue with that. And if you don't believe me, just come to the nursing home round with me someday, and I'll show you that, okay? So with that dramatic finish, not to put too fine of a point on it, but I'm going to turn this over to Kirby Kruger, who's the Section Chief of Disease Control at the North Dakota Department of Health, to discuss more in depth of variant viruses in North Dakota and the United States. Thank you, everybody. Thanks, Kirby.
Thank you, Dr. Hostetter, and thanks for being here today. Really appreciate that. So today I just want to briefly cover variants, and we're just going to review some of the events that happened this week and what we were seeing in North Dakota for variants. Previously, the CDC had three COVID-19 virus variants, our SARS-CoV-2 virus variants that they classified as variants of concern. They were the P1, which was originally identified in Brazil, actually Japan, but they were coming in from Brazil. B1351, which was the South African, and then the B117, which is the one that is generally referred to as the United Kingdom variant. But this week, CDC added two additional variants to their list of variants of concern. They are B1427 and B1429. Oftentimes in the media, you may see this as the California variants, and even CDC refers to them as California variants, but they were first identified in California in 2020. So we have the 5 variants of concern, but in addition to the two that they added, CDC is now classifying, has 3 broad categories of classification for variants. They have variants of interest, variants of concern, and variants of high consequence. Those variants of interest that they've identified, and there's 3 of them on their list right now, those variants are variants that have genetic markers that may indicate that these viruses may be more transmissible, or they may be less susceptible to vaccination. In other words, vaccines, our natural immunity may not be as efficient against them, or there's markers there that indicate therapeutics may fail, something like that. It's not been demonstrated, but those genetic markers are there. For variants of concern, these are variants that have been identified to be more transmissible, or there may be some concerns or some demonstration of less efficacy for therapies or vaccines, that type of thing. And then for variants of high consequences, the categories that they look at, and there's no variants of high consequences in the United States that have been identified. Failure of current diagnostic tests to be able to detect them, failure of current vaccines to protect against, failure of current therapeutics for treatment, and then a significant increase in disease severity. Those are the things that they're looking for when they are looking to see if something fits that classification of a variant of high consequence. North Dakota now has 11 variant cases, and these are all variants of concern. We have 7 of the B117 are the UK variant. We have 2 of the B1427 and 2 of the B1429. So there's 11 total there. So these are of concern, and I just sort of mentioned this before, but the characteristics that make these variants important to public health is can our diagnostic tests detect them? And for the most part, for the variants of concern, our diagnostic tests are able to detect, especially our amplification tests. A change in disease severity, a change in disease transmission, and for the variants of concern, there is increased transmissibility. The UK variant is about 50% more transmissible, and then the two California variants that we've talked about are about 20% or so more transmissible. So there's a moderate increase in transmissibility. And then there's always the question about how immunity will work. And I think Dr. Hostetter really summarized it very well, that the vaccines that we have available to us are really very good at protecting against disease, are protecting against serious disease. And so I think that's an important message that we want to remember. So in North Dakota, how we conduct surveillance for variants and how we look for the variants is that at the state public health lab, when we receive samples in and a sample tests positive, those samples are reviewed because, at least for the UK variant, there's a telltale sign in the genetic markers, that one of the sets of genetic markers that we look for, and that there's a change in those markers. And so when we see that, that's characteristic of the UK variant. And so when we see that, that's a good screening criterion. And when we see that, then that sample can go off to whole genome sequencing, and they can actually look specifically to see if the changes to the genetics are there that would be able to classify that as a UK variant. And then we also take a random sample of our positives and we do whole genome sequencing, because the other variants of concern that we have don't have that characteristic drop off in those genetic markers. And so you can't use that screening. So there's a random sample that is tested using whole genome sequencing. And then we also participate in national surveillance. Every month we send 34 samples down to CDC for whole genome sequencing. So that's part of the national surveillance system that's in place. We also are asking laboratories to submit their positive samples to us so that if we need to run whole genome sequencing or look for a variant in that those samples will be available and they're not being disposed of. Currently, our laboratory does have some storage capacity that they can do that, and so we are asking laboratories to help us out with that part of it. So the good news, I think, is that we have vaccines that are available, and the vaccines that we have available protect against all three of these variants. And so being vaccinated is really important. I think one thing we need to think about is, in order for a virus to replicate, it has to get inside of a person. In order for COVID-19 to replicate, the virus has to get inside of a person. In order for mutations to occur, that virus has to be replicating. And so actually, when people are infected, we're just sort of the incubators for that virus. And every time that virus replicates, that is when mutations are going to occur. And so what we want to do is we want to reduce the number of susceptible incubators we have out there for this virus. We don't want people getting sick. And that's a good reason. That's the best reason in the world to get vaccinated. We don't want people getting sick, and we don't want people hospitalized, and we don't want people dying. But this also helps us in the fight against variants, is if we can get people vaccinated and reduce the risk of them becoming infected, or if they do become infected, of not spreading the disease, then we're also helping to reduce that risk of new variants being developed and new variants being propagated. But there's also more good news, and I think the more good news is that the measures that we have been talking about the last 13 or 14 months that help prevent the spread of COVID also work against the variants. So the things that we've been talking about over and over, please wear a mask in public places, practice social distancing, washing hands frequently, avoiding gatherings, especially if social distancing cannot be maintained in that gathering. And if you're ill, staying at home. Those types of things are still important. And it's also important we continue to test people for the virus, as that's the only way we can continue to look for the variants and look for changes that may be occurring. It's also the way that we measure what's happening in our population in terms of the number of people who are ill. And so I think testing still remains an important part of it. So people, if you're out and about more, and a lot of people are out and about more, or if you're attending events more, it's a good idea to think about being tested on a regular basis. And we also want to remind people that wearing a mask is still important. The CDC recommends using a mask with multiple layers and making sure the mask covers the nose, mouth, and chin and fits snugly to your face. A recent report from the CDC and the Morbidity and Mortality Weekly Report looked at county-specific data where mask mandates were in place, and they assessed masking mandates with the death rates, the growth of death rates, and the growth of case rates. And what they found was that in those counties where there were mask mandates, they saw reductions in the case rates and the death rates, the percentage of those rates, growth rates. So I think the bottom line was that at least in those counties in this particular epidemiologic analysis, those counties where there were mask mandates, as soon as 20 days afterwards, they were starting to see a decrease in the percentage of cases. And so I think that's good news. In this particular study, they did control for restaurant closures, bar closures, stay-at-home orders, and bans on gatherings and that type of thing. And so there were some controls that were built into the analysis on that. So, but I think that it's important that that we take the time to be vaccinated. Vaccination protects us. It protects the people that we love, that we are closest with. It provides other benefits as well. People who are fully vaccinated don't need to quarantine if they don't have symptoms. People who are fully vaccinated can visit with other fully vaccinated people without the mask and the social distancing. And they can visit other fully vaccinated people without these other precautions. But they can visit others who are not fully vaccinated from a single household. And so if you're going just a single household to a single household, and one household isn't fully vaccinated, you still wouldn't need to, they still wouldn't have to take the precautions. I think the big rule of thumb is that you're not going to know who's all fully vaccinated, and you're not going to know who's at high risk. And the CDC and the North Dakota Department of Health just wants to remind people that people who are at higher risk for disease, we need to really be careful around them. Now, if they're fully vaccinated, that's great, and you're fully vaccinated, that's great, and the precautions become less important. But if they're not vaccinated, it's really important still to continue to take those precautions. So I think the other part that I just want to mention about being fully vaccinated is that even fully vaccinated people should still take some steps to help protect themselves and others, especially when they're in public and when they're gathering with people who are not vaccinated or gathering with people who are at a high risk. And then also, unvaccinated people, that includes children, should continue following all of the basic prevention measures. But that's sort of what I had today, and we're certainly open to questions. Molly and Dr. Hostetter and I would stand for questions. And I don't know names, so I apologize. So.
That's okay. I'm Sam Nelson with the Tribune. I have a question about the CDC data for counties with mask mandates. Are you aware of any North Dakota counties that were included in that study?
My understanding is that the study period was from March until December of 2020, and that they looked at all of the counties that had any mandates, and they looked at the period, the 60 days, if I remember correctly, the 60 days before the mandate, and then the 100 days after the mandate. And so they looked at all the counties in the nation that had a mandate. And so at that point in time, there would have been a short period of time where North Dakota would have had mandates. So, yes.
Oh, I'm sorry. I have questions for Molly, I think.
Okay, Molly.
Yes.
You mentioned that this change to open up eligibility is not due to any demand concerns, I suppose, but I'm wondering, what has demand looked like for phase 1C?
So, I mean, it is somewhat due to demand. So I think essential workers, we're hearing a lot of people don't realize who is an essential worker. And so people who work at restaurants are essential workers, farmers are essential workers, manufacturing, transportation, so whether that's an Uber driver or an airline pilot. And so I think there's a lot of confusion over that. And so that's probably why some areas are seeing less demand for vaccine, because people aren't realizing that they're essential, or they're thinking of it more as like healthcare workers or teachers or something like that. And so we feel like this will open up vaccination more. And since over half of North Dakota is considered an essential worker, this will help people find access to vaccine and know that they're eligible for vaccination. Additionally, with underlying health conditions, over half of North Dakotans have at least one underlying health condition that puts them at increased risk for COVID. Over half of North Dakotans are obese. And so a lot of people aren't going to, walk into a clinic and say, hey, I'm obese, can I get vaccinated today? Or I'm a smoker, can I get vaccinated today? And so this allows us to better communicate with individuals that everyone 18 and older should be getting a COVID-19 vaccine is our current recommendation.
And then I guess a follow-up to that, how do you know that the lack of demand is due to people not understanding the messaging as opposed to just not wanting the vaccine?
Yeah, and there might be some that it's hesitancy as well. I mean, I'm not saying that it's not hesitancy. I think I've been clear that there's some people who are still undecided about COVID vaccine, and so that's probably some of it as well. But we do have regular conversations with healthcare providers, local public health. We hear often from the public, and so we do get kind of a sense as to what's going on out there in terms of vaccination from them. And that's what we were hearing, even from working with the Department of Commerce, that people were really confused over who was an essential worker and who was not. Yes?
Have you guys hit like a deadlock in appointments at all with demand? Bringing this on board, do you think more people will start getting in, especially in those maybe those more rural areas where they might have that North Dakota nice mentality and won't immediately put themselves out there to get it?
So the appointments for vaccination really vary at a local level, and it's up to providers to schedule those appointments. But I do think it's varying by area. You probably heard Custer Health opened up vaccination, so they were seeing that they weren't getting appointments for vaccination. Fargo and Grand Forks are still, filling all of their appointments rather quickly. And so I do think it is varying by state and by area. And so whether that's due to uptake or acceptance of vaccination or this confusion over who's an essential worker, it's probably a combination of all of those. I do think this will just help in continuing to get as many people vaccinated as possible as soon as possible. But even this week, North Dakota was still one of the top in the nation in terms of percent of doses administered out of those delivered. And so providers have still been able to administer doses rather quickly in the state.
That was actually going to be my follow-up question. We're still in the top states for rollout. What do you accredit that to?
Well, I think some of it is we made a concerted effort in the state of North Dakota to get vaccine to where people actually are, so where they live, where they work. We have over 400 providers enrolled to receive and administer COVID-19 vaccine. We have a state warehouse that's able to break down the vaccines into smaller quantities and get it into the more rural areas, where I think in other states they have more larger vaccination clinics where people have to travel long distances to access vaccine. I think providers from private healthcare to public health to pharmacies have really prioritized COVID vaccination and made an effort to get vaccine out as soon as it's come into the state. And then I think we did have high acceptance of COVID vaccination amongst residents. And so it's really from now on, I think we've shown we can get vaccine out the door and providers have the capacity to vaccinate. So moving forward, it's going to be up to North Dakotans in terms of, how much vaccine we're putting into our arms. Yes.
I think you mentioned a little bit at the beginning that for 16 and 17-year-olds, it might be a little bit harder to access the vaccine since only the Pfizer vaccine is approved for people in that age group. I'm wondering, is there any way to go about that if you want your 16 or 17-year-old to be vaccinated, and what would the timeline look like for opening it up more to that group?
Yeah, I know our hotline is getting a lot of calls from parents of 16 and 17-year-olds looking for a vaccine. And so most of the Pfizer vaccine, because of the large shipping quantities, is going to the more urban areas, our health systems. I think as we start receiving additional doses, which we're hoping towards the end of this month and in April, we'll start receiving higher allocations. We'll be able to spread that vaccine out more. I'm also hopeful that Pfizer is discussing changing their minimum shipping quantities. So right now it's 1,170 doses. And so they're looking at dropping that down significantly lower, like around 200 doses per shipment. And so that would be helpful. And then I do know the CDC Vaccine Finder website, vaccinefinder.org, will show which brand of vaccine each provider has. And so the public will be able to see, where Pfizer vaccine is at. Or I have heard recently we have a lot of people looking for Johnson & Johnson vaccine, and it's in extremely short supply right now. We're only getting 900 doses a week the past couple of weeks. And so they'll be able to go to the Vaccine Finder website and see where the J&J vaccine is. And then additionally, the manufacturers are conducting clinical trials right now in children. Both Moderna and Pfizer have started trials in children 12 to 17. And this week, Moderna announced starting clinical trials down to as young as 6 months of age. And so I do think this summer or fall, we may see COVID vaccines available for the adolescent age group. And so that's another reason for me to plug, get your back to school immunizations now if you're an adolescent and due in the fall for back to school immunizations. Definitely get them now because you can't give COVID vaccines at the same time as other vaccines. Yes, I think you're next.
Molly, I have a clarifying question. So you said that when we're rolling out, as you open up vaccine availability to the general population, are providers with the federal retail pharmacy program, such as Thrifty White, also following that directive?
Yes, the federal pharmacies will also follow the state's directive. And that is a good reminder, too. The federal pharmacies are receiving all 3 types of vaccine. So Pfizer would also be available, and J&J at the pharmacies receiving vaccine directly through the federal government. Yes?
Yeah. Talking about the 3 different vaccines, do you guys hear from people saying that they have a preferred favorite or hear that very often? And then do they really have much of a choice? Because I know we always say, or you guys always say, the best vaccine you can get is the one given to you. But can they really make that choice? And have you heard from them saying that they really prefer one over the other?
Well, everyone has a choice in which vaccine to receive. The issue is more of a supply issue, and we don't want to see people waiting to be vaccinated against COVID-19 because they're waiting for a specific brand. And so our message has really been to get the first vaccine that you're eligible for or offered. But yes, we have heard of everyone has a different brand that they would prefer. But I know right now at our hotline, most of our calls are people looking for the Johnson & Johnson vaccine and preferring just to have that single dose vaccine as opposed to having 2 doses. Yes.
I'm wondering if maybe you can dispel something I've heard. I know people who prefer the Johnson & Johnson vaccine because they have a history of allergic reaction to other vaccines, and they seem to think that that one is safer. Is there any validity to that?
Well, the Johnson & Johnson vaccine in clinical trials did not have any what we call anaphylaxis, so severe adverse events. And neither actually in clinical trials did Moderna or Pfizer. But once Moderna and Pfizer started being used, then rarely adverse events of anaphylaxis were reported in those vaccines. They both are rare, so less than 5 per 1 million doses administered. And so if they're concerned about anaphylaxis, that might be why they're wanting to try the Johnson & Johnson vaccine. But there's technically not a contraindication to receiving the Moderna and Pfizer vaccines unless you have a severe allergy to a component in the vaccine. Any other? Yes?
Perhaps for Kirby, I think.
Sure.
Yes.
Yes, Rick Becker with Beck News. Couple questions for you. Today, Dr. Fauci came out and indicated that there was a 64% increased likelihood of death with the 117 variant. And you indicated, or maybe Dr. Hostetter indicated, a 50% increase in transmissibility, which we've known for a while. But as recently as last month, it was believed that the severity of disease and the likelihood of death was no greater than the original COVID. That's pretty dramatic. Are you taking any steps? What's your reaction to Dr. Fauci's announcement today?
Well, I think that's the first time I've heard the official announcement, so you're the first one who's sharing that with me. So I haven't seen anything official from CDC, but I do know that they had suspected that, from some of the work that was done over in the United Kingdom, that this could have a more severe outcome, a higher probability of a more severe outcome. And so I think that's still another message. I think the good news is that, again, the UK variant there's a very high level of protection that can be offered from vaccination, and I think that's the good news. So I think it's just important that we continue to take precautions because this variant is more transmissible and it's the most popular or most common variant that's found in the United States. And so I think it's just emphasizes again the importance of taking precautions.
And the B1351, the South African variant, that's currently present in 23 states, not North Dakota yet, but in several close states as well. The Moderna and Pfizer vaccines are not very effective against that variant. The Janssen or Johnson & Johnson vaccine, I believe Dr. Hostetter said there was a study with 100%. I think that was for deaths after 28 days. Another part of that same study and other studies indicate 52 to 57% effective, only that much, effective against moderate to severe disease in general. So I think the jury is definitely out on Janssen with regard to South African, but not with the other two. That's just not effective. Now, Moderna and Pfizer are announcing that they're going to be coming out with boosters to add on to the 2 shots that they're currently recommending. Are there discussions in getting in line and being prepared to accept booster doses when they're ready to accommodate these variants?
I think that's something that we have talked about, is that there's a possibility that boosters may be necessary for variants as they emerge, just depending on the nature of the variant. But we do know that at least the vaccines that we have, they do provide some protection, and as Dr. Hostetter said, that there's some protection that's provided against serious disease that results in hospitalization and death. So, yes, is it Megan? Morgan, I'm sorry. Okay.
I was just going to ask if you knew kind of the level of protection. Is it different from, I guess, the common COVID-19 virus versus the variants? Because I think we've been hearing from people saying that maybe they wouldn't get the vaccine because maybe they'll get the variant and it won't protect against it. So do you have any numbers there that we can use?
I don't have numbers except to say that I think what we understand most about the vaccines with the variants, especially with the UK variant, is that they're all very effective against the UK variant, which is the most common variant in the United States. And so there may not be the same level of protection with some of the other variants, but we do know that they're probably going to protect against serious diseases, and there's a probability of that, and so I think that's the important part, is that we can keep people out of the hospital and keep people from dying and getting serious disease. That's still important. So.
Molly.
Okay, Jimmy.
I think we've talked before about how nursing home employees have this lower rate of vaccination than some of the other priority groups, and maybe one of the reasons for that is that they don't see a lot changing in their workplace in terms of the health precautions that they would have to abide by. I'm wondering, do you think that the possibility of return to a normal life, a maskless life, is a good carrot to people, and what would be the timeline on that?
You want me to get out my crystal ball and when we won't recommend masks? I don't know that I can give a timeline on when we no longer have to avoid social gatherings or no longer are recommending the wearing of masks. I think we want a high amount of herd immunity. And so it will be a certain vaccination rate. And then I think the jury is still out on how long duration of immunity lasts after natural infection. I do know long-term care vaccination rates amongst staff continue to increase. So as of data reported this past Wednesday, 55.3% have received a single dose. That's up more than 10% from when they were first offered vaccination. And I think I've said before, our healthcare workers and long-term care workers were offered vaccine first, and the vaccine is under emergency use authorization. And so just like the general public, they had some hesitancy or were undecided about being vaccinated. But I do feel like now that more than 115 million doses actually have been administered in the United States, they're starting to feel more comfortable about vaccination. They see that their coworker got vaccinated and did fine. And so I do think more people are going to accept the vaccine. But I do see where they're coming from, that they don't want to have to wear the PPE that they're wearing right now and things like that. And so I hope it's coming that there will be some changes in that direction. But we have to remember, we still are only at 1/4 of North Dakotans being vaccinated. And so we have a ways to go to where we can start changing some of that. Yep.
Moving on to opening it up to the general public, when we look at other states and what they're doing, how big of a milestone is this for North Dakota, and how far ahead are we from other states and what other states are doing the same thing?
Well, I actually do have information on other states opening. I know Montana is opening, I believe, April 1st. I'm trying to find my data here that I have. Alaska and Mississippi have already opened to the general public, and then I know a number of other states from Utah to Michigan are all opening up vaccination to the general public. And I think a lot of the reason is the same. It's just a confusing message when you're picking and choosing essential workers and underlying conditions, and so it really streamlines the message, and then makes sure we're vaccinating as many people as possible, as quickly as possible, to try and get ahead of these variants spreading. Any other questions? None on the computer? Okay. All right. Well, thank you all for attending today. And if you haven't already, go and get your COVID vaccine because everyone's eligible March 29th. Thanks.